Do your eyes constantly itch, burn, or tear up, especially during allergy season? You're not alone. Millions of people across the United States, United Kingdom, Canada, and beyond battle with eye allergies every year. But there's one non-prescription eye drop that's become a go-to solution. This is Alaway. But is it really effective? How does it work? Is it safe for long-term use? In this video, we break down everything you need to know about Alaway Eye Drops, what they do, how to use them, who they're for, and how they compare to other popular brands. Stay till the end for expert tips and some surprising insights you don't want to miss. Alaway is an over-the-counter antihistamine eye drop, primarily used to treat symptoms of allergic conjunctivitis, an eye condition triggered by allergens like pollen, dust mites, pet dander, mold, and more. The active ingredient? Ketotifen Fumarate 0.025%. Now, here's why that matters. Ketotifen is a dual-action compound. It not only blocks histamine, the chemical your body releases when exposed to allergens, but also stabilizes mast cells, preventing further allergic reactions from starting in the first place. In simple words, Alaway doesn't just relieve symptoms, it helps stop the allergic process at its source. And the best part? One application can last up to 12 hours, so you're not constantly reapplying drops throughout the day. Alaway is designed to relieve a very specific set of symptoms caused by eye allergies. These include itchy eyes, redness or bloodshot eyes, watery or teary eyes, burning or stinging sensation, swelling of the eyelids, and a gritty or foreign body sensation. Important note: Alaway is meant for allergy-related symptoms only. If your eye symptoms are due to infection, injury, or chronic dry eye, this drop won't help, and might even irritate further. Alaway is generally safe, but there are a few exceptions. Children under 3 years of age, if you're pregnant or breastfeeding, consult your doctor. People with chronic dry eye, glaucoma, or other eye disorders should use Alaway with caution. If you wear contact lenses, remove them before use and wait at least 10 minutes before reinserting. Also, avoid using Alaway with other eye drops unless advised by your doctor. It could dilute its effectiveness or cause interactions. Like all medications, Alaway can cause side effects, though most are mild and short-lived. Common side effects include temporary stinging or burning, mild redness after application, dry eyes or blurry vision for a few minutes, and in rare cases, headache or nasal congestion. Stop using and contact your doctor immediately if you experience persistent eye pain, visual disturbances, or signs of infection like pus or crusting. But again, most people tolerate Alaway very well, especially when used as directed. Now let's compare Alaway to some of its biggest competitors. Zaditor has an identical active ingredient, Ketotifen, and works the same way. Alaway is often more widely available in stores. Pataday, which contains olopatadine, is a slightly different molecule that sometimes works faster but is more expensive. Claritin Eye also contains ketotifen, so again it's very similar. Bottom line? Alaway is just as effective as many prescription-grade antihistamine drops, but available without a prescription at a much lower cost. Want to get even better results from Alaway? Here are a few expert-backed tips. Combine with oral antihistamines if your allergies are severe. Use cold compresses alongside drops to reduce swelling and irritation. Avoid rubbing your eyes. It worsens inflammation. Clean your eyelids and lashes with gentle hypoallergenic wipes during allergy season. Store Alaway in a cool, dry place. Extreme heat or cold can affect the solution. Correct usage is key to getting the full benefits of Alaway. Here's a step-by-step guide. Wash your hands thoroughly to avoid contamination. Shake the bottle gently. Tilt your head back and pull down the lower eyelid. Instill 1 drop into the affected eye, or both if needed. Close your eyes for a minute or two and avoid blinking. Wait at least 10 minutes before inserting contact lenses. Dosage: use 1 drop in each affected eye every 8 to 12 hours, not more than twice per day. Tip: for best results, try using Alaway before going outdoors during allergy season. It may help block symptoms before they start. Have you tried Alaway? What worked and what didn't? Share your experience in the comments. We'd love to hear your story. And if this video helped you, give it a thumbs up, subscribe to our channel, and turn on the bell so you never miss out on smarter health choices. Watch our next video where we compare the top 5 over-the-counter eye drops for allergies and dry eye. You'll be surprised which one came out on top.